They're live.
Okay, so we're back. This is Senate Health and Welfare. We're going to finish looking through H 938. I think it's our final walkthrough, Katie.
Okay.
Going through. We did look at the rental assistance bridge program language that came to us yesterday. I haven't heard anything back from folks on that.
Okay.
So I think with your blessing for legal advice, and language.
I integrated it yesterday on the working draft I have. I did, just so no one's surprised, rearrange some of the order of the sections. But the content is there.
That's fine. We'll see that next week, I guess.
Okay.
All right. And so what page are we on, you know?
5 is section 12.
Page.
35.
Oh, wow. So here's my plans this morning. We're going to go through a little, the rest of the bill. And then, Nolan is not with us, but at some point we'll have Nolan go through the money that's in the bill. And then so we won't do that today, probably. I'd like to finish just a few minutes early today, to get the floor reports organized, and then we'll, and then we're gonna come back to 938 every day. This is we are devoted to this bill.
Julia, we planning on getting out the hedge fund only.
So tomorrow we do not have 938 on our agenda tomorrow. We have other bills on the agenda that we're gonna work on and try to complete work.
Because that was important.
It's on
And that to finance.
Senator, it is on the calendar tomorrow morning at 8:30. I haven't yet moved us to 8 o'clock, so we'll stay at 8:30. And then we have testimony on that bill. And then we'll see where we go with it. Then we have 270, 817, which is the peer-to-peer, the mental health bill for kids. And then 573, the emergency examination bill. There are some that are a little easier than others. So if our time clears up tomorrow morning, we might be able to go back to 938. We'll see how that goes. But we will spend time on 583 tomorrow. And hopefully we can get to some closure on some or all of the language. And next week we are focused. Okay.
Okay.
So Katie.
Hello again. So we're looking at section 12. Should I just jump right in?
Sure,
Okay.
please.
So this is language that directs DCF in collaboration with AHS and relevant community partners to establish a payment rate structure, including periodic rate reviews for all shelter services required by the Act. The structure shall include a base rate and potential for supplemental payment to the base if necessary and appropriate. On or before April of next year, the department shall submit a report to the policy committees with the implementation of the payment rate structure and the department's proposed timeline for implementation. Okay.
Okay. So this is important, but I also would ask the department, I'm looking at Miranda, I'm glad you're here. What currently is being used for, could you bring us information about how the shelters are currently being paid, what the payment structure is from your perspective? Because we have a list of things in our bill. And I'd like to know, where did the numbers come from? How are they calibrated, collected together?
Yeah. Good morning. For the record, Miranda Gray, Deputy Commissioner for the Economic Services Division, and I'd be happy to share with you. I'll connect with the Director of the Office of the Economic Opportunity to bring you how our shelters are currently.
That would be great. That would be very good. And I'm also thinking of, are there shelters that are not included in that? So, for example, the one shelter that is important to us in the whole Chittenden County, Northwest Vermont area is the Community Resource Center, CVOEO. And they are currently, they've been one-time funded now since 2010, 20. And it seems to me that with the work that they do they act as a hub, and then they have folks going to different services outside. Well, it seemed to me we'd want to make sure that places like that, and I don't know how many others are in the states, are included in that payment process. So that's something that I'm thinking about. I think it's important, and because it was frustrating during the budget process to sort out how to be inclusive. So thoughts from the department or the agency would be very helpful on that one as well.
Yeah, thank you for bringing that up. So you're triggering something that I don't understand. So I take it there must be contracts between the agency and
Shelter,
I'm guessing whoever runs the shelters.
community organizations.
There you go.
Yeah,
And they must come up every 2 years, 3 years, 5 years, I don't know. And then this is establishing here.
payment process.
That's right.
I think
So a
it's
base
base funding.
plus they have the opportunity through the contract, I'm guessing that they're gonna draft to do additional supplemental. Am I saying that right?
Do you want to speak to that? That would be great.
Sure. Yeah, so you're right. Currently, we do have grants, not with all shelters, to your point, Madam Chair, is that there are some shelters who operate without engagement with DCF. But those that we do and we have funding opportunities, and I think this would be a change from how we currently fund shelters. And so I think we would want to explore what that payment structure would look like. And might need some time to be able to establish what that would look like as we would move forward into something like this, because it would be so different from what we're doing now.
Okay. Thank you.
Should have asked someone. Okay,
Okay, next section is 13. Fiscal year 27 capped room rates. If you remember in the chapter that would go in the green books, it asked that part of the budget presentation that there is information coming back to the committees about capped room rates. But because it wasn't part of the budget process this year, because this wasn't in place yet, this is specific to fiscal year 27. So this asks the Department of Children and Families, Community Partners, not to pay a hotel and motel establishment providing providing emergency housing more than the hotel's lowest advertised room rate and not more than $80 a day per room to shelter a household participating in the continuum. DCF or community partners may shelter a household in more than one hotel or motel room, depending on the household size and composition. And I believe that $80 tracks what was in last year's budget. So what has been happening this current fiscal year. Section 14, expenditures. So as I think you've heard from Nolan, that the 82 million is in the budget, so it's not being appropriated here, but there are directions for how the expenditures should be made here, and that's what is in this section. So the breakdown is here.
why don't we just look at it briefly? And I know this is no one's part of the bill, but we can just look at it just to be familiar with what the categories of funding, what the funding is for.
Okay, so you have funding going to the Housing Opportunity Grant Program operations.
Okay, well, I have a question about that actually, for HOP. So the HOP program, I guess DCF, you guys can help me. The HOP program will fund for what? For day shelters only, or for both day and 24/7 shelters? What does the HOP program fund?
Yes, thank you. So it funds all. It can do where it's just an evening. It can do the cold weather shelters, but it can also fund those that operate year round.
Okay, so then But I'm going back to my original question on the Community Resource Center. Because that is a place where there are shelters that are both day shelters and full coverage shelters. Are those, is a Community Resource Center eligible for HOP funding?
Yes.
Does it get HOP funding now?
I believe that it does, but I would need to check.
I'm not sure.
You're not sure.
Yeah.
I would need to.
Let's find out, because that's a bone I'm gonna keep picking at with that. So, yeah, I see different heads going.
I'm being told no, but I will
Yeah.
confirm with the.
Please do. I know that Lily will probably be able to help out with that.
Question for you, or the budget. All of this is aimed towards ending homelessness. What kind of funding is there in the budget for housing? Is there, I assume there's some kind of a grant for,
There's housing, and remember, the rental assistance piece that we have in there is huge for moving people into housing. And then we also have looked at VHCB, as VHCB.
well, that's what I'm at, is
Yeah.
did we increase funding for VHCB in the budget? I didn't hear it.
It's in there.
It's in there,
Yeah,
okay.
I don't know how much over
If it-
26, 27 is. I can't answer that question off the top of my head, but I've got it somewhere.
But the 4 days, federal funding.
Yeah.
But there's two different things, right? The 82 million is for this. You're talking about something different that will
Well, the
limit
end point of all of this is to get
housing.
people out of
That's right.
homelessness, which
Sure.
requires housing.
For us.
We have like 1 or 2% vacancy rate, if that, in this state. So we have a housing shortage. So we're putting people through step 1, step 2, step 3.
Yeah.
But when they get to the end of the steps, what happens? They're still on the street, so why put the effort in? I mean, that's where I'm having trouble with this.
We're all having trouble with that, which is why there's concurrent work on housing through the VHCD and Vermont Housing, the State Housing Authority and others. So,
We heard from the housing authority,
yes,
but we know that Section 8 is on shaky ground right now with the federal government.
Yep.
The housing we're building is basically apartments.
Mhm.
But could we hear from the HCD about what are we building? I mean, what's coming online?
we'll get some information.
Okay,
on
yeah,
that.
what's
We can do that.
in the,
I don't know that we're gonna have full testimony on it.
no, but just,
you
that
know,
would be
Yeah,
good information to have.
right. And we did have Polly in on the disabilities housing funding for that. And that's just a piece of
Yes,
the broader VHCB funding that is in the budget.
yes,
I don't know how much is there, but I'll get that.
yes, if we need.
Now, it's a really good point to be made. We're doing all this work. Take people out of homelessness, and then how do we move them into a more permanent housing solution? The rental piece does some of that.
But rental is housing.
Yeah, rental is housing, but it's also housing that the SHA and VHCB are making available, so we need to know what that is. You know, we don't want to go around in a circle, I understand. So, where are we?
Subdivision.
We're on capital road rates, and Senator Cummings is very right in identifying the housing problem as part of the solution to all this. Go ahead.
Okay, the second expenditure is for shelter development. Third is for emergency housing and hotels and motels. Fourth is for case management.
All right, let's go slower here.
I'm sorry.
The first one was the HOP. And the second one. Shelter development. Do we have data indicating that this is the right amount for shelter development? Brendan, I'm looking for you.
Brendan Atwood, Cost Director for Agency of Human Services. So, I think in what we had proposed actually was some additional shelter development. So I think that we see a need even beyond, what this would provide, but we think that this is a step in the right direction.
Okay. Okay. And it would also be, I think, I mean, for me, there's some reassurance in supporting the shelters that currently exist. I'll go back to my little mantra. Okay, we need to look at that. Number 3 is,
Emergency housing.
okay, that's a lot of money, isn't it? Okay. Do we have data indicating that that's a need that's coming up to 27? I mean, I'm just sorting out how this is calculated, that's all. So we'll sort that out a little bit.
It's not about what we spent in the hotel. I thought it was about 25.
What?
I thought we were spending about 25.
That's exactly what it is here, it's like 23.
4 million,
And that some of it's base and some of it's one.
one cover.
Okay, and then
Under, it's full.
one time 14 million. Base funding, then theoretically, base funding would continue to go forward to catch folks who require motel, hotel funding, and the rest is what we currently need as we begin the program. We don't, and so we need to know how that fits with the need that's out there. So keep going.
Okay. So you have in subdivision 4, case management.
Okay,
In 5, you have permanent supportive housing and family supportive
I
housing.
just, I didn't mean to keep going. I'm gonna ask a question about it, you know that. But so case management, so this is going to individual service providers?
Yeah, let's speak for that right now.
I believe it's, sorry, because it has changed, in iteration.
No, it's fine, yeah.
I believe that this is money that we would grant out, to be able
Okay,
to have case management happen.
okay. All right, we want to know a little bit more about that one too. Okay, and then 5, okay.
5 is the permanent supportive housing and family supportive housing.
So this would be money that's in the budget for what Senator Cummings is asking about. More permanent homes.
So how does that work?
Permanent supportive housing is different than
It is.
permanent.
It's like the disability housing that we were
Yes.
talking about, or folks with
Or
other
people with
needs.
mental health or physical needs. I mean, we already have an issue up at the new housing in Berlin, which is mixed income.
Mhm.
There was an incident with a BB gun being shot at the senior housing across the street, somebody being wounded. There are apparently some people who are not. So putting people in housing doesn't mean they know how to be good neighbors.
As long as they have support. We're putting people in housing with support.
Yes,
That's
that's
yeah.
important.
So I'm not sure the 4.2 basically, does that buy down a mortgage or costs or how's that work?
How does this work? So I'm gonna go first to the department and then we'll look for help for the Housing and Homeless Alliance folks. Go ahead.
Yeah, and, I'm gonna have to be the director of Office of Economic Opportunity, under the expertise. But I can certainly.
No, that would be good. What I'm going through is trying to get to the questions that we had, so we'll have all the information that we need and, look at that, it's a miracle. So,
Always gonna talk about policy.
did you want to add something, Brenda?
Yeah, I was just gonna say
For the record.
sorry, Brendan Siegel and Homelessness Vermont for the record. I was just gonna say that permanent supportive housing is not buying down a mortgage or anything like that. It is, support services in the housing. So it allows people, to retain their housing. It's why, the organizations like Pathways, Dash, and then Homelessness Vermont all provide permanent supportive housing support services so that people don't end up back in homelessness.
So give me an example of some of your supports.
So it depends on who you are, but in our case, we're working with somebody, for example, who has muscular dystrophy
Yep.
and has been moved into housing. This is a recent example. And they need to be connected to a new physical therapist. They need to be connected to have potentially choices for care and to get reconnected to medical providers that can come into their home because it's not easy for them to leave their home. That is something that we help connect them to. We also help in this case with all of their applications, with their renewals and for certifications for their low income housing and additional any kind of additional support.
Okay, so we're gonna
weekly.
hold it
Yeah.
there because we want to finish going through this list with Nolan. And then what I'm asking for is data for each one of these areas, and I'm looking at the department for this. And how that funding will be used exactly, and what is the needs for that funding. And then there's also the distinction between case management and offering services. And I know that with conflict-free case management, there has to be a separation of those, and I don't know if that fits with this as well as with the DAs and SSAs, whether that's a federal requirement for those or not. Now, I'd like clarity on that because I don't know who's providing those services or case management. So that there might be something. I don't know. Maybe not. Okay, so Nolan,
Hi,
how are you?
good. How are you?
Good. I
Long
think.
time no see.
A question I have for you, we can go through the rest, but we only have like 5 minutes left. We want to finish early. But, so we have a bunch of money here in this bill.
Yep.
And how much of it is ours and that we can play with?
People's money?
There it is.
All right, so what I'm gonna try to do, both my
Or-
fiscal note, we're talking about, we're looking at the bill.
Appropriately, I guess.
Sure, we're looking at the bills introduced, right?
So the money was appropriated.
So
It was in the big,
I will explain that in a
You know,
second.
he'll
Let
be
me,
like, he's good at explaining.
82 billion or something.
yeah, let me pull up, I wasn't prepared, so let me pull up my fiscal note. Like,
And this is only the first time we're looking at it. You're going to be sitting here more formally for more than 5 minutes.
Okay. Yeah. And for the record, Mulling with Joint Fiscal Office. So there's many ways to look at this. What the governor did was the governor had 82.6 million, so that's all the way in the bottom right. What the House tried to do to keep the construct, they said, look, you have one time, you have base funds, you have federal funds, and you've got global commitment, and then they fall into different categories. The House said, we are going to stick within those boxes, but we're going to change the spending from what the governor had, but we're going to work within those boxes. And the reason is because federal funds have very restricted. You can only use federal funds for certain things. If you take money that was in global commitment and you use it for something that's not global commitment matchable, suddenly your 82 changes just by the nature of what those funds are allowed to be used for. So what the House tried to do is live within that boxes to change how the governor spent it within those boxes. I don't know if that helps. So if you look at the next chart, which is, this is kind of how it laid out. So these are the 10 appropriations, and you can see how they go across. And ultimately what the House was trying to do was fit when you look at the bottom, the total, the 56.7, the 21.2, the 1.1, 3.6, and 18.6. They were saying, look, we're going to shift the money around the different funding and add things and subtract things, but we're going to, everything has to fit within those boxes. So you have that same sort of flexibility within that, but you have to be careful. If you want to add something or subtract something, you can do that, but you might change the funding, and that might be a decision for you. Say, you know what, we don't mind that, but then it does mess the budget, and that's why it was done in the budget and in this bill. So what the budget did, as the House, as the Senate passed it, you broke it out and you said, specifically 21.2 in one-time general funds, 1.1 in federal funds shall be this, but you didn't break out the 1 through 10. You didn't say it's going to go for case management. It's not going to. In the House, they did, because they tried to match it. In the Senate, you said, you know what? We're going to keep in the boxes, but we're going to let the committee have some flexibility in how that's spent. So there's two spending bills. It's appropriated in the budget by these boxes, but the spending is being determined by this bill. So your flexibility is you have to spend within the budget context that's passed by the Senate. Does that help? Yeah. Now, obviously, making those decisions can get complicated. You're like, wait, does that fit in base? We're going to move that to federal, and that's where, you know, Kay and I will try to best to help you get there.
So I think, federal, you're not gonna be able to do much with global commitment, maybe not. One time is where I'm guessing
General fund.
you're gonna be able to.
Base general funds and one time.
Right,
Those are where you have the most flexibility.
right.
But still, so you can move things around. You can take something out and add something new in. You just want to have 56.7 and 21.2.
82.6, yeah.
Well, if you leave the
I
federal,
know,
you
yeah,
don't match
yeah.
the global commitment and I mean, you can, but
No,
it gets more complicated. So,
Well, some of our decisions might actually lead to a match, but
so then what I also have, which I didn't present, but I have a sheet that shows the difference what the governor recommended and how that compares to the House passed bill.
yeah,
and the
you gave us
Delta.
that, I thought.
Okay, it'll look like this, but that way you can,
Yeah.
it's a little bit wider. And I can get that to you, but
Yeah.
actually you can see the
That'd be
difference of
great.
like, I just don't have that. And I think the health department has it too, good.
Can you put it on the screen?
That, I have to find it.
no, we'll do that
Yeah,
another time.
yeah.
I'm very interested in having us go through this with Nolan. And it probably won't happen till next week. We're going to have to do this very deliberately. If we're meeting on Tuesday, we can do it on Tuesday. If the floor time goes over, forget it. So Nolan, can we plan on Tuesday for this? And then it'll be
I think I have a very important hair appointment about this.
oh no.
Getting implants, okay.
I wouldn't recognize you. Well, either if we do it Tuesday, we'll do it first thing Wednesday or when you're available.
No, I'm coming out.
Okay, that would be good.
I didn't mean to be so self-deprecating.
We'll be available. We'll have that information you as well.
That would be good. I think I just wanted to get our feet wet and a little bit walking in the puddle, and now we can dive into it a little more and try to understand how we can shift things around a little bit. So what we're going to do right now is, Katie, we're pretty close to the end of that bill. I think we might be able to finish it off tomorrow briefly with the effective dates, but we're going to call it a wrap today, and we're going to rehab the floor. Our lives are very complicated these days. So tomorrow we'll start at 8:30, please, at 8:30, and then we're going to try to finish off a couple of bills, and we'll continue on with 9:38 with Katie. We're going back to the beginning, finishing the end, whatever we can do. That's where we are. It's good. Thank you all. Not an easy